Okay. Well, and for those who did, for the 20% who did watch this before, I'm sorry to repeat myself, and you can catch me on whatever I've changed from one time to another and call me out on it. Um, but I usually start by saying that there are a lot of things that I could have been asked to speak on for which I could claim more expertise than writing specific games pages. And really the only credentials that I bring to this talk is having served for several years on the NINDS NSTK study section, the study section that reviews all the Institute's clinical trials other than the special emphasis panel that's being used for clinical trials now. And in that role, I've had the opportunity to read a lot of specific games pages. So I'm familiar with a range of what folks do, and I've seen positive and negative reactions to what folks do. I've also written quite a few specific games pages for grants, some of which got good reviews and were funded, and more that got poor reviews and were not. So I'm not sure if that's a credential or not. Um, but I really don't have any disclosures relevant to this talk. This should be one of the shorter webinars in the series, which is why I think there should be plenty of time for discussion. And what we're really going to talk about is what makes a specific games page so important. And I think everyone would agree that it's really important, but I don't think that it can be overemphasized. And we'll talk a little bit about why the specific games page is important. We'll talk a little bit about what I think are some of the hardest parts of writing a good specific games page. There's a lot of things that make writing a good specific games page hard, and most of them are obviously going to be project specific. So there's not a lot I can tell you about your specific page. That said, there are a couple of common stylistic elements that are also hard to achieve, but can really improve this kind of page. Then I'll suggest a proposed structure or template for specific games pages. This will be something upon which there isn't agreement, but I'll pitch my preference and you can like it or not. And then we'll use the balance of the time to discuss your questions and concerns. So the specific games page is your big chance to make an elevator pitch for the grant you're proposing. And there's at least three really good reasons why this is important. And the first is that a lot of people are only going to read your specific games page, which is really frustrating and really difficult and hard to hear. But this is because of how the NIH review process works. Your grant is going to go to a review panel of maybe 20 folks or more, and all of them are ultimately going to vote a score for your application. 2 or more will be assigned as the primary and secondary reviewers, and there may be a tertiary and statistical reviewer assigned as well. The primary and secondary reviewers, and probably the other assigned reviewers, are reliably going to read your entire grant application from snout to tail. They'll read it thoroughly, they'll understand it, I hope, and they may or may not read your appendices. But the other 15 plus folks aren't going to read your application all the way through. They're going to hear about the grant application in a presentation by the primary and secondary reviewers, and the additional reviewers are going to just sort of add additional comments. Then there's going to be a discussion among the whole panel. But typically, during that presentation, the other members of the committee are going to be bringing up your application on their screen. Maybe they'll have it printed out, and they're going to start browsing it. And a lot of them are going to be browsing it for the first time, since they were assigned other grant applications, and that's what they read in preparation for the meeting. And the thing that they're going to look at mostly is your specific games page. And that moment is your chance in that room to sell directly to those 15 plus people your idea, independent of what the reviewers have told them. And that might be all they look at. They might skim other elements of the grant. Different folks do different things. Some may flip to your figures or your methods specifically, but everyone's probably going to read the specific games page for the first time right there. And like I said, although the assigned reviewers may be the only ones who read the application, everyone on the panel votes, and no one's vote counts more than anyone else's vote. So your specific games page is your chance, is your whole grant to the majority of the review panel. So it's your elevator pitch, and it's your only chance to talk to most of the reviewers. The next reason is that the specific games page is important, is related to what this guy says. I always say that years ago I wouldn't have had to need to say who this guy is. Everyone would have immediately recognized this as Will Rogers, but nowadays you have to tell people. Anyway, Will Rogers is famous for saying a lot of things, but one of the things that he's famous for saying is that you never get a second chance to make a first impression. And there's no question that that's true about your specific games page as well. Independent of all these folks who are only going to read your specific games page, even your reviewers, who you really have to sell to, are going to read your specific games page first. And what we now know is that this isn't just homespun wisdom from Will Rogers. Cognitive science demonstrates that he's absolutely right, and that this is actually how people think. Most people make decisions in a fast-thinking, snap judgment kind of way. They read something quickly, they look at it, they form an opinion, and then they spend whatever additional time they have available on the matter trying to rationalize and justify the decision they've already made. So your chance to get the reviewer hooked, interested, engaged, excited about your project comes from this initial look at the specific games page. If you get them interested, they'll spend the rest of the time reading your application, looking for reasons to like it and support it. If on their first glance of your specific games page, they're disinterested, bored, confused, then they'll probably read the rest of your application looking for reasons to score it poorly. So there's no question that first impression is the hook, and it's the key. The third reason that the specific games page is important is that it's sort of the page that people read most often. And what I mean by that is, at least what I do as a reviewer, and I think a lot of other people's do, is they use the specific games page as a map for the 12 pages that follow. So as you start getting into the 12 pages of the grant that are dense and detailed and data laden, methodologically complex, and when you get sort of lost, you say to yourself, what are they even trying to do here? And then I'll go back to the specific games page, try to figure out and remind myself exactly what the applicant is saying and how it relates to the fundamental question being answered. So if you can provide that map in your specific games page, if you make it clear there how everything else that you're going to unpack in your 12 pages relates to your goal and your purpose, then the reviewer can use that repeatedly to understand what you want them to understand. Additionally, I'd say that the reviewer is going to go back to your specific games page when they have to fill out the review on the summary statement form, and they'll have to answer the questions on what is the significance, what is the innovation, etc. And to the extent that you can give them a clear, concise statement that explicitly answers those scoring criteria questions for them, anywhere in the grant application actually, but especially good on the specific games page, you're making it easier for them to give you a more positive review. If I can find the statement, this is innovative because, then I can just cut and paste that into my review, and you've made my day. So one thing that you should always be trying to do in your specific games page and throughout the grant application is make the life easier for the reviewer. A happier reviewer is more likely to give you a happy score. So I want to talk a bit about what is so hard about writing a good specific games page. Obviously, given what I just said about how important it is, it's clear what's hard. You've got just one page to summarize your whole project and clearly explain all the complexity and nuance that you've worked out for the past 6 to 12 months, and get it right, and get it clear, and get it detailed, and get it exciting, and everything else. So that's incredibly hard by itself. But equally obvious is that the hardest parts are going to be project specific and are going to differ for each of you. So that's just inherently hard, and I can't tell you how to do that. But what I can try to do is emphasize a couple general concepts that are specifically hard to do in writing. And by recognizing the concepts and making them explicit, the hope is that you'll be able to tackle them head on rather than just sort of subconsciously ignoring them because they're hard. So what I want to talk about is the narrative of the specific games page and then some observations on focus. So with regard to the narrative, a narrative is, by definition, a spoken or written account of connected events, and that's really a story. And the specific games page should really be a story. I mean, it should flow. It should take the reader on a journey that will get them excited and take them to a resolution where they want to fund your grant and learn how it ends. It's the story that gets the reviewer engaged. So that may sound a little different from what others have told you, and you may say, gosh, that's not what I've heard. I've heard that the games page is supposed to be like an elevator pitch, but I'll tell you, those are really exactly the same thing. So the elevator pitch is really a story too. So this is the classic elevator pitch sentence structure that you'll find in any Business 101 class or text. And sentence structure says, for a certain customer who has a certain need. I've got this product in this category that has some great purpose, unlike anything you have right now. And that's really a story too. You've got a main character who's the target customer, and the target customer has a problem. They have a crisis. And lo and behold, a hero comes in, a product that has certain powers and abilities that are going to save the day, save the world, vanquish the competition, and save the target customer so that they can live happily ever after. So it's a story, and can think about the pitch format in the same way. And you can also think of it as sort of the classical sense of a narrative arc. So if you've ever taken a creative writing class, or even just a purveyor of popular fiction and movies, you'll usually see this pattern in pretty much how all stories work, with the exception of like David Lynch movies or Kurt Vonnegut novels or Sam Beckett plays or stuff like that. But most Star Trek episodes start with an exposition that sets the scene, then something goes wrong and there's a complication, and then the complication gets worse and worse until finally it reaches some dramatic crisis, which the hero somehow overcomes, leading to a resolution of the problem and usually a newer and better world. So this really can map out directly what you write on a specific games page too. So in the specific games page, you're going to start out with some background, and here's what the problem or disease is, and then there's a specific challenge. If only we could know this biomarker or that biologic mechanism or treat this aspect, then we'd be able to make a big difference. And that leads to an overarching goal of the project, the crisis, and then there's the hero that comes in with a specific solution to answer this problem. And by the way, that hero is you, right? And you're the one that's going to come in and save the day with these specific aims, and you're going to vanquish this problem and lead to an impact, an innovation in patient care where wonderful things will happen for all these people who were suffering before. So that's the story you want to tell, and we'll get back to this when we talk about the structure. Just to touch back on focus now, I think that can be even sometimes harder to get right. And of course, some parts of focus are easy. The specific games page focuses on the specific games. And if this blue guy represents the specific game statement themselves in your application, that's not hard to tell that he's out of focus. And if you invest your time and energy wordsmithing and being explicit to eliminate ambiguity, remove barriers in understanding, then you'll bring the aims themselves into focus. I think everyone would agree with that, and would find that pretty much doable. This should not be the hardest part of focus. The hardest part of focus is that the aims themselves aren't the only part that has to be in focus. So there's also the big picture and the impact. And the impact has to not only be there, but you have to sell it with enough granularity so that people can really see it and believe it. And then there also has to be a backstory. There has to be just enough methodologic detail so that people can start to trust that you will be able to accomplish this, even on this very, 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 very limited page. So ultimately, you need to have every part of this page be, sort of in focus, from your statement of the problem to your solution to the impact. And nothing on the page is a gimme. To make an analogy to photography, you're creating a depth of field by carefully balancing your light or your shutter speed, your choice of film, your resources. The aims themselves are the center of your focus, but people have to be able to clearly understand the stuff around it as well. And that's hard, and it requires writing and rewriting as much as is needed. And this is the one page of your grant application that you need to share with other people for sure, with colleagues and friends, folks who work in this area and those who don't, because the panel won't be all subspecialists in your topic. It wouldn't hurt to have friends and family who are lay read this as well. This is just one page where you want to continue revising it until it's just as good as it can get. So now I'm going to move on and talk about a specific structure for a specific games page. A lot of what I told you so far is subjective, but this part of the talk is purely a matter of opinion. So this is what I do when I try to write a specific games page. If you look online, you can find other templates. I think this is pretty similar to a lot of what you'll find, but everybody has their own preference, and this is not like the single right correct structure. Roughly speaking, this is the structure that I suggest for a specific games page. It really follows the basic structure for an essay that you were taught to write in middle school or high school. It has an introduction, it's an upside down triangle, a thesis statement, then a body, usually in 3 parts, and then a conclusion. The introduction starts broadly and narrows to become more and more specific to your thesis. I suggest this be about a quarter of the page. The extended thesis statement is your idea, your goal, and purpose. That should probably be about a quarter of a page or a little less. Then the body is the actual specific aims themselves, maybe another quarter to a third of a page. And then the rest of the page is the conclusions triangle that builds from your specific focus to the broader impact. I forgot that I built this as an animation. Yeah, so that's really the summary of it. Specific aims pages are critical. The page is challenging. It tells a story, needs to have a wide focus, and consider a template. This link may or may not be current. I'm not sure if we updated this from last time, where there's some examples, but I know that there are some examples available from the course. And with that, I want to hand it over to Jordan to talk about her elements of the specific aims page.
Thank you. I would say, in terms of my background, looking at specific aims, I'm a biostatistician, so I've looked at lots of specific aims pages. Sometimes they're in the development stage, and sometimes they're actually grants that I've submitted, or that I'm reviewing. So kind of a lot of different contexts, and I definitely agree with Robert. There's lots of different ways to do this. Can you advance the slide? I don't think I can. Thank you. So I just want to kind of frame this and let you know I am bringing in the perspective of the statistical reviewer. They're really going to be looking at your specific aims page to understand what it is you're trying to do and why that's important. So understanding the significance, and then how you're going about it, what your design is in a nutshell. And I've always been taught that you want to have consistency between the specific aims page and the statistical analysis. And that probably goes true with the whole grant. You don't want to be saying something in the statistical aims page that is contradicted later on in the grant. But there's a lot of examples where I've seen and reviewed grants where there is inconsistency. And when inconsistency occurs, it's sometimes just because there's not perhaps the best communication between the statistician and the PI. Next page, please. So the first thing that a statistician needs to know is, what is the research question? And from the specific aims page, what you're looking mostly there is to give it in scientific terms, right? Like the hypothesis. You could state your hypothesis in statistical terms, but really oftentimes, and people do it different ways. Sometimes you'll see it, the null hypothesis, alternative hypothesis written out very clearly. But really, I think the intent, I think, is to give kind of like the scientific hypothesis there. And then later on, the statistician will kind of translate that into the statistical hypothesis that you're testing. As long as those are consistent, you can use different words to convey the same objective. And so sometimes on the specific aims page, you might give like an overarching hypothesis of what your body of research is attempting to do, but you really want to be very clear about what this specific proposal is looking at. And so that it's easy to do that, when this proposal is doing exactly what you really want to do, which is, let's say you really want to demonstrate that this particular drug works, and you're designing a phase 3 trial to do that, then that's pretty easy. But if you're in kind of some of these earlier phases of clinical trials, it's a little harder, right? You're in a different stage where you can't demonstrate efficacy, and so you are doing some of these more preliminary steps. And so the the aims of those and the become very important, and they need a lot of input from the statistician. I like to see a specific aim that's written in the form of something that I can understand what population, what groups you're comparing, and what you're measuring. And a lot of times people will talk about their response variable, but they don't give time points. So it's unclear what, how you might be measuring it and how you might be analyzing it. Next page, please. So the what you're measuring question for the statistician is quite important because it kind of helps us define how we're going to analyze the data. So if it's measured multiple times or if it's just measured one time, those are very different analyses. Oftentimes specific aim pages will use a lot of constructs. So I want to demonstrate that my treatment slows the decline of Parkinsonism, or I want to demonstrate that my treatment is neuroprotective for this disease. But how are you measuring that? That's what you need to make sure you convey along with the construct. It doesn't have to be long-winded. In fact, the more succinct, obviously, the better. But you should be, if you're going to use a construct or some type of jargon, make sure that you do define it, because the reviewers that look at this are not going to all be in your field or familiar with those constructs. Next slide, please. Aims consistent with analysis. So I talked about this already a little bit, but basically, when I'm looking at an aim and I'm reading an aim, I can envision usually in my head what kind of analysis you're doing. And so if I get an impression, let's say that you're doing something that you're actually not doing, that means you have an inconsistency between your aims and your analysis. And sometimes it can be tricky, or especially around the phase 2 designs, because you're not powered for efficacy. So even though you want to show that your treatment is better than control, you probably not actually set up or designed to do that. You probably have something like you're showing that it is not futile, or showing you don't want to demonstrate whether your treatment is worth continuing to pursue. So those things can be a little more tricky to wordsmith and get them refined in a way that's both clear to the clinical reviewers and the statistical reviewers. But so what you want to do probably as you're crafting that specific aims page is don't make changes at the very last minute without kind of checking in with your statistician and saying, hey, just want you to know this is our updated specific aims page. I want to make sure I'm not messing up the analysis plan. Demonstrating safety, that's something I see a lot. I've seen that a lot on specific aims pages, and it always kind of seems to kind of imply that the person writing the grant hasn't done a whole heck of a lot of thought about what that might mean. It's a very vague statement. It's very hard to prove that something is safe. So you might be able to see if something it has a very high tolerability rate, but you need to define what that tolerability is based upon. And if you're looking at like safety outcomes, well, what kind of safety outcomes are you looking at? So that just really needs to be very well thought out. And those are conversations that will drive the sample size and the design that you end up with. So make sure that you talk to your statistician about that. Next slide, please. And I did just want to touch base on exploratory aims. So I hear so many different opinions about whether to make that third aim, an exploratory aim or not. There's definitely pros and cons. I think somewhat it's nice to maybe have a well-rounded grant that has, a third aim that's more exploratory, but some people will just naturally see that third aim and say, okay, well, that's a weakness. That's because it's not going to have as much power and it won't be as reproducible. So I think, I think if you are going to do an exploratory aim, I would say do it well thought out, make it as pre-specified of an analysis as you can do for exploratory aim. So really kind of think about um, what what variables are going to go into that analysis. Um, Next slide, please. Was there any more slides? Maybe that was the last one.
That's the last one.
Okay. All right. So I think we did pretty quick. Questions? Comments?
Everybody does have the ability to unmute themselves. So if you have any questions, just go ahead and unmute and shout them out.
I have a question. Thank you very much for the talks and the overview. So what if you, at the stage when you're writing the grant, you have, let's say, preliminary data running, and you'll have as soon as the grant will be approved and the project could be started, you have the data for example, calculating sample size, etc., but you don't have it at the stage of when you're actually writing the application.
Well, the preliminary data, I guess, could be updated. I think in terms of your design, your sample size now, probably, I guess, that might impact your budget. So it could be problematic, if you think you're going to maybe need 100 patients and suddenly you need 200 patients based on your preliminary data. So I guess it would always be good to perhaps be more conservative as you're planning, since you don't have that preliminary data. It's also okay to take more time and not submit that cycle if you want, to kind of, I think there's a lot of thinking that goes into kind of once you finally get your final results, making sense of the data. And so sometimes it is good to get input from different sources and think through it and present it publicly, and maybe think through that data very thoroughly before just throwing it into a grant proposal, because the reviewers are going to think of it if you haven't yet thought of it, right? So that's that would kind of be my thought. I think the more you get input from other people, the stronger the science.
Thank you.
The only thing I would also add to that is that it is not many grant applications that get funded on their initial submission. So most grant applications require a revised application anyway. And so, there's a lot of pressure to get grant applications in. And you could be conservative on the sample size estimation, knowing that you're going to be able to refine it later, but get it in and find out what are all the things that they hate about your grant application. You're going to be able to address that concern if they say your sample size has not enough data, and you know that by the revision you're going to have the data to answer that question. You can take that hit. It's the other hits, the things that they say you need preliminary data on that you weren't collecting preliminary data on, that you want to know about. So sometimes you don't want to turn something that's not ready in, because it'll just get squashed and maybe not even discussed. But you can take some hits, knowing that you'll have the data for the revision. Usually there's more questions. If there's not more questions, I can, embellish on a few things that I skipped over. One of the things that I see missing from the specific games page a lot that I'll mention is um, talking about yourself and your team. So, like I said in the story, in the elevator pitch, you're the hero, right? You're the one with the solution. But the 2 lines or something in the specific in the statement of problem things that says what the solution is that you're going to test. Too often people don't say, and we're the people to do it. We're prepared to do it. We've put together this unique team to do it. Nobody else has this background. Nobody else has this team. And I don't know if it's because people feel uncomfortable tooting their own horn, or they don't want to say, they don't want to put themselves up, but you're asking for a big investment in you and your team, and saying in the specific games page, again, everything in the specific games page is very brief, but saying something about why, your team is here's the proposed solution, and this is why we're bringing it to you, and we're the right people to bring it to you. I see that missing a lot.
Yeah, I would just reiterate too, that the overall impact is kind of the big things that you score on, right? And so if you can come away from reading that specific game page, not just understanding what you're trying to do, but understanding why it's really important, I think it is very helpful as a reviewer.
Yeah, that's a big one, right? And it's the same thing. It's the shy investigator, right? I mean, there are people who are not shy about telling you why they're, the best thing since sliced bread. But a lot of people feel like it's being very scientific to say, I'm going to test this one little thing, and I don't want to overstate, the fact that this is what I'm doing. But you have to overstate. I mean, you have to explain why that one little thing is part of a bigger, important picture, and that not only needs to be in the grant, it needs to be on the specific aims page. So the end line, should be, this is really important because it's going to do this. This is a critical step in, on the path to helping people, right? Because I mean, ultimately, that is the impact, right? But who you're helping and why.
And I'll definitely say there's been grants I've reviewed when I've gotten hung up on that, the impact of what they're trying to do, because I just don't get it. So not everybody is coming from your field and will clearly understand that. So the more you can kind of explain it and sell it, if you will, the better.
And a lot of times that's what I use the lay friends and relatives for, right?
Did we have like we used to have some examples that we showed of some good pages? Should we pull those up, I wonder, and talk them through?
Yeah, let me see if I didn't prep for that, but let me check.
Robin says she's putting some in Teams.
That link that I'll put that in, and everybody can pull them up individually. Let me put it in the chat. Where's the chat? So that that link that I just put in the chat that was in the slides leads to some sort of pretty old, from 2016. But
Should we share
I can
that?
I can share that too. Yeah.
Okay.
Hang on, give me a second.
Sure if I'm the only one, but if I click on this link, it says like I need additional permission.
Oh, really? Okay, sorry about that. It worked for me because I have those permissions. But let me start by just sharing them. Hang on. Is that a good size for folks, or do they need it a little bigger, smaller?
It's just showing the top of the page.
It's not showing us specific games?
It's showing the top of the page. So I have A, specific games, and then there they are at the bottom. Yeah. To evaluate the clinical effect of ESMO treatment on cardiac function and electrophysiology.
So I think one of the things
stating
we
what's
could talk
going
about here is this style of embedding these sort of multiple hypotheses within the aims, which a lot of people like. I'm not a big fan of that. I think it gets confusing pretty quickly and a little repetitive, and you've got not that much space normally. But it can be very precise, which I think is the advantage. I don't know, Jordan, do you like that style?
So I think I feel somewhat neutral about it. I think but on the one hand, I'm looking at this and I'm going, there's 1, 2, 3, 4, 5, 6, 7 hypotheses. My first question is going to be, what kind of multiplicity adjustment do they have, right? Especially the first one, 3 primary hypotheses. But I think when you come from different fields, where the aims tend to build on each other and the body of work tends to build on each other, and there's different samples used for different aims that tends to be used a lot. So like in basic science, aim 1 might be a completely separate experiment from aim 2, and so it makes sense that you would have perhaps multiple hypotheses for each aim. When you're talking about a single sample, this to me seems like maybe a lot, but it is an early phase trial. So it makes sense that you're probably interested in multiple things, and type 1 error control is not particularly important at this stage, because you're really just trying to decide whether you can move forward. So a long-winded answer.
It also alluded to one of the other rules of thumb that may or may not really be a rule of thumb, and you got to decide whether to believe it or not, and that is the independence of specific aims. So one of the things that I was always taught was that the specific aims should be independent of each other. You don't want specific aim 2 to depend on what you found in specific aim 1. If you fail to answer specific aim 1, is it a house of cards and the whole thing falls apart? Or are there, multiple aims, each of which stands on its own? And I think that that's probably a good rule of thumb. I don't know that it's a commandment. I think there are times when, you know, your scientific project scientifically is I'm going to learn something, and then I'm going to, you know, in the 12 months after I learn the first thing, I'm going to do this with the result of that. And if that's how the science is designed and the science progresses that way, then the specific aim should as well. It's riskier. It's riskier scientifically, not just riskier as a, you know, grantsmanship issue. But you know, I think it's not. Sometimes people take it as a golden rule, and I think it's a good guideline, but not a golden rule. But I don't know, Jordan or others.
I agree with that. I think it's sometimes unavoidable, but it's definitely a good guideline.
May I ask a question with respect to aims and objectives? So I'm not a native English speaker, and I was always kind of slightly confused whether what the difference is between aims and objectives. And to my understanding so far, the kind of aims is stating in a brief way an overall aim, and the objectives are slightly more precise and include, for example, outcome measures. What is your understanding of the definition, or what would you advise on when to use aims and when to use the words objectives?
Robert, you go first.
So I am a native English speaker, and I get confused about this as well. And it's worse, right? Because it's, you know, objectives and goals and aims and hypotheses, and so I think it gets even potentially more confusing. And if you're looking for the right answer, there isn't one. And different people use them differently, I think, both intentionally and unintentionally. My view, I mean, I tend to think of the objectives and the goals as being the higher level functions. You know, why am I studying this topic? And what is, you know, what at the end of my research, what do I want to achieve? You know, I want to achieve better seizure control in my epilepsy patients. And then aims, I don't use aims without specific. So I only talk about, the only aims I talk about are specific aims. And the specific aims are much narrower. The specific aims are specifically, what question am I trying to actually answer, right? So my goal is to help, you know, get a better therapy. My specific aim is to test this drug in this kind of patient. I think you can usually get away with the specific aim being a sufficient statement of the hypothesis that you don't need to have both a specific aim and a hypothesis. But sometimes you do. But you know, here's an example where, you know, where the specific aim is really a statement of hypothesis, without having to separate out those words. But a hypothesis needs to be very specific, right? The hypothesis is exactly what you're going to test, and it needs to be directly, even if you have it worded separately for the statistic, there's a statistical hypothesis that's different in wording from the scientific hypothesis, which Jordan suggested is okay. And I think it is okay, but if you can get a wording that works as the statistical hypothesis and the scientific, so that it's, you know, clear enough that everybody can understand it, that's even better. Mm-hmm. And it is specifically what you're going to test. It tells you, you know, what population you're going to measure, what outcome from, at what time, and what difference, if you're doing a hypothesis test type of statistic, you know, what difference you're looking for. So that's, you know, that's the specific, that's the high specificity, and my goal, my objective is the higher level thing that this all leads to.
And I would have said that objective is the same thing as a specific aim.
See, so there you go. You can't win for losing.
Okay, thank you.
So I can leave this one up. I don't know if people have any comments about this one. I think there's a few more. There's 5
I would just
examples.
say like that, the wording there for specific aim 3 of this one is it's a better wording than what to prove something is safe, right? Does duration have a differential effect on safety and quality of recovery? So you're not going to be able to say that this hypothermia is safe, but you're characterizing the overall safety and adverse events associated with the duration of cooling. So I think there's still like, how are you going to do that? Maybe, but at least it's to me, I know this is going to be a descriptive analysis. And you're going to look at a number of different safety things. So that's a fairly, I think, sophisticated way of phrasing it.
Yeah, and and I agree with what Jordan said about exploratory aims before, is that it's sort of a, um, but uh, I personally do allow in my mind people, as long as the specific aim 1 and 2 are very specific and really tell you what you're going to do. I'm pretty liberal with allowing people to have a third aim that is a little mushy, right? A little more nebulous and a little less specific, because I figure that, there's no way that they're going to power a study for 3 completely different, aims. So there's always stuff that you're going to look at that you're not particularly well powered for, haven't designed the study, and whether those things, um, whether you can claim enough advantage for those things to be a specific aim, is that nebulous question. You're definitely going to do it, so you'd sort of like to be able to claim it, as one of the benefits and one of the goals of the project. But 3 exploratory aims,
Frustrating. Yeah.
is gonna, that's not gonna fly.
I think you're absolutely right. Like if this one had, because it only has specific aim 1, 2, and then if 3 was exploratory and it's broader, that's okay. But like if you're trying to tack on a very big exploratory aim at the end of that first example where you have 1A, 1B, 1C, 2A, 2B, 2C, and then all of a sudden 3 is this, long list of things, I think some reviewers will find that very frustrating. I like this one because it has the definition of what improved functional recovery is, very succinctly there at what time point. Um, I mean, aim 3 is it's almost like saying you don't know what decisions, but you're informing those decisions. It's a little nebulous, but I think that's kind of where you do get when you're in early stage trials.
Yeah. I'm, not liking, especially after listening to what you said earlier, specific aim 2 is a little painful to me right now. I'm looking at that and saying, yeah, that was probably uh, not as good as it could have been. But this one spends a tremendous amount of real estate on sort of these, specific items, which is usually more than I would think. I don't really remember. It's so long ago. I don't remember what we were thinking.
That's a good one. I spent a lot of time thinking about those ants.
Yeah, this one was unusual because the hypothesis is actually stated before the aims, and then the aims apply that same hypothesis in multiple different ways. So there's flexibility. You can do things different ways as suitable for the question at hand. Any other questions?
I'm not seeing any in the chat. If anybody has any final comments, please feel free to unmute yourself. Otherwise, we can end a few minutes early. Thank you so much, Drs. Elm and Silbergleit. We really appreciate your time. This was a wonderful presentation.
Thank you for your attention.
Bye.
Thank you very much.
Bye.
Bye.